What seems to be the problem?
My mother's having trouble breathing.
When did this begin?
About 20 minutes ago, I stopped by her house and found her like this.
Short of breath?
Yeah, she could barely talk to me.
Is there anything you can tell me about your mother's medical history?
She has chronic problems with her right leg.
What kind of problems?
Pain and restlessness, her feet and ankles are swollen. I'm scared. She's been short of breath for the past few days. I told her she needed to go to her doctor. Please, can you help her?
No. Thursday, no?
Right.
My feet and ankles, they are swollen. It seems I've gained some weight recently. The past few days. Been getting worse. I couldn't catch my breath this morning. Yes, aspirin and codeine too. No. County General Hospital. Better sitting up. When I lie down, it's hard to breathe. 6 a.m. when I had breakfast.
Dr. Anderson, dial extension
Looks like sputum.
5324.
Okay, airway cleared. Okay, lab work drawn.
Yes, that's it.
You're very gentle.
There's always hope, darling. Don't give up on your mama. You hear me? Can you identify that rhythm, doctor? Exactly what I thought. Interesting. See that? Her feet and ankles are swollen. Can you identify that rhythm, doctor? Nice assessment, doctor. Looks like someone paid attention in med school.
You got nothing to worry about, Mama. They're taking good care of you.
Normal saline administered, doctor. What should I administer, doctor? Medication administered, doctor.
I just want to say you're very good at what you do. I've never seen her like this.
Nice work, doctor. You're doing great, Mrs. Gonzalez.
We have to make an appointment with the cardiologist in the next day or two, but it could have been much worse. Dr. Woolridge said that your quick thinking saved my mother's life. Thank you, doctor.
Congestive heart failure is plain and simple pump failure. As the heart starts to fail, compensatory mechanisms kick in to try to help out the situation. The irony is, they may, over time, worsen the degree of failure. Well, I see we're in agreement about this patient's diagnosis. Excellent job of obtaining the patient's history. And your treatment of this patient? Outstanding.
Yeah.
You got a 58-year-old woman with chest pain. She's on 1489 Brookhaven, just south of Spring Street.
Roger, copy that. We're right around the corner.
About time you got here. It feels like there's a house on my chest.
Do you feel pain also?
Of course I have pain. You're about as sharp as the one who just left.
Ma'am?
My ingrate daughter, Allison. She just flew out the door.
Okay, when did your chest pain begin?
As soon as I had that shouting match with my daughter.
Uh-huh. And when was that?
About 10-15 minutes ago.
On a scale of 1 to 10, how would you rate your chest pain right now?
A 4. But the more I talk to you, the worse it gets. Yes. Yes, it does. I had coffee and a bowl of cereal this morning. I think it was about 8:30.
Well, I do feel a little better now that my daughter isn't yelling at me. Karen Marie Baker. Yes, I have angina. No, it doesn't. No. In my living room. Where else would I be? It's Tuesday, isn't it?
Yes.
Yes, I take Prilosec for my acid reflux. I have nitroglycerin too, but I can't remember where I put the bottle. None that I know of.
Oh boy, we got a live one here.
She claims I'm the difficult one. Me!
Yeah, good idea. Do you recognize that rhythm? Good eye.
Oh, I wish this pain would just go away.
You know, somehow, I think this is gonna be a long day. And what do you see on the monitor? Right, that's what I think too. Okay, which one of these should I administer? All right, you're a natural. So which one of these should we give the patient? Nice, you got it. Looks like I'm just along for the ride.
Well, maybe that's a little better. Oh, if only my daughter treated me as well as you do.
Well done, my friend.
I'm feeling much better now. I don't need to go to the hospital. I'm fine. They told me that your prompt treatment helped save my life. I just wanted to thank you for all you did.
I see that Miss Baker had angina pectoris. That chest pain she had was really a result of her heart's demand for oxygen exceeding its supply from the coronary circulation. A lot of people don't know this, but angina is not a disease but actually a symptom of myocardial ischemia. I concur with your diagnosis. Top-notch work in obtaining this patient's history. And your treatment of this patient? Outstanding.